203, take one.
Great. So first, can I have you introduce yourself? Just your first name, first and last name, like we just met.
My name is Jeanie Reed.
And Jeanie, can you tell me um, a little bit about your story, high level? So I know you were referred to the health department by PACE, um, and so kind of what led you to where you are today?
What led me to where I am today?
Mm-hmm.
Years and years of drug abuse led me to this seat right here today. I have been in recovery for 2 years and 7 months. I just celebrated my 2 years, 7 months on February 4th, which happens to be my birthday. My sobriety date is on July 4th, which is kind of unique to me because it's a celebration of independence from drugs and alcohol. I have been in and out of institutions, incarcerations, and mental places due to not knowing what was going on with me. I had no idea that I had a disease. I have a twofold disease. I have a disease of the mind and of the body. I am highly allergic to drugs and alcohol. I break out in hives and or handcuffs. So I didn't even know for decades what was going on with me. I just knew I couldn't stop when I wanted to stop. I didn't know how to stop when I wanted to stop. And I knew that I didn't want to continue stealing life from myself, stealing things from other people, and stealing time from my family. It took a rocky road to get to that point. However, once I knew that something had to be different and I had to change or I was not going to live, um, I got down on my knees and was like, I'm over it. I'm done. A lot of people say they got arrested. I got rescued. So that's how the realization started was a long time ago. Like everyone was telling me I had a problem, and the courts were telling me I had a problem. My mom was telling me I had a problem, but I did not think I had a problem because everyone else had the problem. It wasn't me. A lot of people identify as I'm a junkie. I hate that word because it's almost like it's a derogatory word for one. And when you classify people into that negative stigma, they almost identify with it, and that's detrimental. It was for me. Like I thought, and I classified myself as a junkie. I'm a junkie, and I was okay with that because I just related to that. But I'm not a junkie. I am an addict who has a disease. So I don't know. I think I veered off your question.
Well, What helped you learn that that is a disease?
I hmm, I can't say any names because of the program that I work. However, a 12-step recovery program taught me that I had an obsessive thought process, and I had no idea that what I was thinking was normal for hundreds and thousands of other people. For the longest time, I just thought I was alone in this battle. I mean, I had fair weather friends who were fighting it with me, but I did not realize the magnitude of people who struggle with this disease every day. And I don't feel alone anymore. I don't feel ashamed anymore. Thank God I am an addict. My 12-step recovery program teaches me to live a different way. So I'm just learning every day. And I don't ever want to forget the past because my past is my past. However, it got me to where I am right now. And I'm happy with it. I'm not ashamed anymore. I don't live in shame and guilt or remorse. So it's a wonderful feeling. It took me a long time. Like I said, I've been struggling with addiction and substance abuse disorder for, let's see, I'm 40, and I started using when I was 12. And I really don't want to do the math on that because, but that's decades, decades. So
So now you're on the other side of it and you're doing well, you're in recovery. How has that been? Was it, I know it's probably hard, right?
it was not rainbows and unicorns, that's for sure. It's hard. It is very hard to go sometimes one moment to the next moment without thinking those crazy thoughts. I had to learn how to reprogram my brain. And how do I do that when I'm so scattered right now? I can't even make a peanut butter and jelly sandwich because my thinking is sick thinking, and I myself can't fix myself with my sick thinking. A sick brain is gonna just make a brain even sicker. It was hard. I'm not gonna lie. I wanted to quit sometimes. I wanted to throw in the towel. I wanted to run because that's what's comfortable. When something is uncomfortable, what do? I run, I fight, and I freeze. But I didn't run, and I continued to fight. I want to live, and for years, I didn't care whether or not if I lived or woke up to the next day. The birds chirping don't annoy me anymore. It's a blessing to actually hear the birds. Prior in active addiction, and I would be like, "Why are you squawking?" Or, "Oh my God, I hear the birds. I did make it another day, and I didn't want to." So, um, I don't know. It was not. It's not always easy. However, it is doable. I um, I wake up every day being blessed, whether or not it's just the breath in my air or in my lungs, but I wake up every day being blessed. Not always happy, but blessed. When I first came into this process, it was like overwhelming. You're telling me that I have to do all these things every day, day in and day out, and yep, you do. So, I don't know. I'm enjoying life again. And it's getting, as I have had some time in this process, it's getting better. Some days are great, some days are horrible. And I reach out to friends and fellowship to get through those hard times. And I'm making it. So I'm not going to say I'm going to be here forever, but while I'm here, I'm going to make some noise.
What advice would you have for somebody who does struggle with addiction, substance use disorder?
Um, who, for someone who is struggling and is looking for help, there is help out there. A lot of times, we as addicts can find that next buzz or that next fix, but we can't find help because we don't know what resources there are. We don't know who we can trust. When you're in an active addiction, you don't trust anybody because that means death. And so I think that if someone who's first, realizing that, hey, maybe I need to live a different way, or maybe I need a little bit of help, um, there is help out there. There are resources that you can use, and there are people you can trust. I'm not saying give them all your trust. A little bit goes a long way. And just know that you're not alone out there, and use your resources. Even if it's you go into that mindset of, well, I'm just going to detox because the court says I have to. Okay. Have back problems, like the court being on your back, your mom, the probation, the parole. That's okay. Because maybe, just maybe, when you're in a situation, a conducive environment, you'll pick something up. And you'll see what everybody else who's in recovery doing and be like, man, kind of want what they have. So it doesn't matter how you get there, just get there. So I think that's and hold on. It's like I said, it's not all rainbows and unicorns and happy moments. There's a lot of sweat, there's a lot of tears, there's a lot of pain. We as addicts don't like any of those things. That's why we self medicate. But there are these promises that they speak of, and they do come true. And just hang in there. And if you need to speak to anyone, I strongly suggest you find a fellow addict to speak to, or they have recovery coaches and they have peer counseling and they have even hotlines. Because for me to walk into a meeting, a recovery 12-step meeting, was like, nope, I'm not doing that. These people are crazy. Well, I was one of those people, and I earned that seat there. So I'm proud now. In the beginning, I wasn't. And all those things that you're feeling, that's completely normal because hundreds of thousands of people have gone through it. So just do it. Just get the help. It's out there.
Thank you.
Thank you.
Is there anything else that I didn't ask you about that you want to share?
No, I mean, this was fun. No, I think one thing that I would like to stress is that substance abuse disorder can go misdiagnosed. A lot of people have substance abuse disorder and mental illness, and it's precarious because you just don't know. So don't be afraid to get a diagnosis of some sort. I didn't know what was wrong with me until someone had to sit me down and be like, this is why you think the way that you think. And I think education about my illness really gave me hope there is treatment. I've been walking around with a cancer in my system, and I never got the medical treatment or spiritual treatment or recovery treatment that I needed. So I just let it grow and let it grow. So I think just knowing what is wrong with you and knowing that and identifying that, yes, you do have a disease and there is things that you can do to treat that disease is very important for people who don't know that they have a disease. So, yeah. We good?
Thank you.
You're welcome.
Yes,